What are the survival rates for follicular lymphoma now? Imagine living with a type of blood cancer that often progresses slowly and can be managed effectively. That's what many people with follicular lymphoma experience today. The current 5-year relative survival rate for follicular lymphoma is around 90%. This means about 9 out of 10 people diagnosed with this condition are expected to survive at least 5 years after diagnosis compared to people without cancer. Survival rates can vary depending on several factors like the stage of the disease, age, and overall health. For example, if the lymphoma is caught early at stage 1, the 5-year survival rate jumps to about 97%, showing how important early detection can be. Younger patients under 55 tend to have higher survival rates, around 95%, while those over 65 might see rates closer to 80%. Women generally have a slightly better outlook than men, with survival rates around 90% versus about 88% for men. Looking beyond 5 years, studies show that about 70 to 80% of patients are still alive 10 years after diagnosis. When adjusting for other causes of death, the 10-year survival rate is about 86%. This indicates many people live well beyond 5 years, especially with modern treatments like rituximab, a common therapy that targets cancer cells. However, survival can be lower for those with more aggressive disease features, or if the lymphoma transforms into a more aggressive type. Doctors often use tools like the Follicular Lymphoma International Prognostic Index to estimate individual risk. Patients in low-risk groups have 5-year survival rates around 91%, while those in high-risk groups may have rates closer to 53%. Despite these differences, advances in treatment have significantly improved outcomes across all risk levels. It's important to remember that these statistics are based on large groups and cannot predict what will happen to any one person. Every patient's situation is unique, influenced by their health, how their disease responds to treatment, and other factors. If you or someone you know has follicular lymphoma, talking with healthcare providers about personal prognosis and treatment options is essential. In summary, the overall 5-year survival rate for follicular lymphoma is about 90%, with early-stage disease doing even better. 10-year survival rates are also promising, with many patients living long lives after diagnosis. Modern treatments have made a big difference, and ongoing research continues to improve outcomes. Remember, these figures are based on current scientific data and should be discussed with medical professionals for personalized advice.